all surgery carries potential risk. As operations go, arthroscopy is a very commonly performed one. It's a small operation and the risks are very, very low. However, the main risk we'd be concerned about are that of infection. The risk of getting a deep infection within your knee from a simple arthroscopy is less than 1 in 1,000. It really is very rare. If you're unlucky enough to have that problem, we can deal with it, and that normally involves a washout. Little wound infections can be treated with antibiotics just in the skin, and again, they're actually pretty rare.
Specific risks of an arthroscopy are that it can be a bit sore, usually not for much more than 10 days, usually uncomfortable for the first 2 or 3 days, and tails off pretty rapidly after that. We usually tell patients that the only restrictions on them after a straightforward arthroscopy are to keep it dry for 48 hours, shouldn't dry for 48 hours, but after that, pretty much can do what you like. Usually tell them to keep it off work for about a week, maybe 2 weeks if they have got a relatively physical job. By 4 or 5 weeks, they should be feeling reasonably comfortable and be able to do most things.
The main risk people have heard of and worry about is DVT, or deep vein thrombosis, and in terrible circumstances they can go to the lungs and cause problems. Because it's a small operation and patients are mobile from immediately afterwards, it's very unusual in arthroscopy to get a blood clot or a deep vein thrombosis. I would say the risk of that is by far, again, less than 1 in 1,000. It's much more common after more major surgery.
The vast majority of the patients who are going to have these sort of procedures are relatively young. Most of them are under the age of 50. Not all, but the vast majority. Most of them are going to be relatively healthy as a result, and so the general risks of an anaesthetic are very, very small. There is a small risk of bleeding into the knee joint. That is rare. If that happens, the knee is swollen and uncomfortable for 24, 48 hours, but 99% of the time will fully recover, may need some ice on it. The most important risk after any of these procedures, and particularly after arthroscopy, is that we can't promise that we're going to turn the clock back 20 years or completely cure patients' symptoms. We would be very disappointed if we don't make their symptoms much better. They usually take a step backwards to go forwards, but they should feel much better in the longer run.
There is a downloadable PDF document about arthroscopy risks available on the resources section of the website.